Good afternoon. This is a short video about what every man should know about prostate disorders, including cancer and erectile dysfunction. Dr. Ann Katz is a registered nurse, and she states the following up-to-date information. 2.8 million men have been diagnosed with prostate cancer in the United States. 60% of the diagnosed cases are 65 years old or older. Tests for prostate cancer include prostate-specific antigen, or PSA, in which blood is drawn for a lab test, digital rectal exam, called a DRE, performed by your physician to feel the prostate gland by way of the rectum, and then diagnosed by biopsy. Black men appear to be at a higher risk for prostate cancer. It is not known why. Prostate cancer is scored according to the Gleason grading system for risk determination: very low risk, intermediate risk, or high risk. This is according to the amount of abnormal cells found in samples during a biopsy. This picture shows how an enlarged or diseased prostate could interfere with urination and sexual performance by obstructing. It can be due to prostate infections, benign prostate hyperplasia or BPH, or prostate cancer. You'll notice that the triangle is your bladder, and underneath the bladder, the purple ball-looking thing is your prostate. It also surrounds the urethra, which is where the urine flows out through the penis. Well, if that prostate is enlarged, you can see how it would obstruct urinary flow. It also affects how sexual performance and erectile dysfunction happens. Treating the side effects of prostate problems, low-risk prostate cancer patients may progress so slowly that cancer poses no risk to their health, and their doctor may choose to just watch. Surgical removal of the prostate or a prostatectomy may have side effects: urine leakage, erectile dysfunction, altered sense of orgasm, a shrinking of the penis, or loss of the ability to ejaculate. Radiation therapy adverse effects might include the above, plus rectal pain and bleeding, fatigue, and infection. The first-line treatment for erectile dysfunction includes products like Viagra, which most of us are familiar with, and it is the least invasive because it's a pill. But if contraindicated because of other medications that the patient may take, there are other options. Other options include vacuum devices, implants, injections, and suppositories, which cost less. Rectal and urinary side effects are treated according to the symptoms, and they usually get better with time. For your information, orgasm is still possible without ejaculation and even without erection. Excuse me. The definition of erectile dysfunction is the inability to reach or sustain an erection for sexual performance. Over one-half of the males in the United States, ages 40 through 70, have erectile dysfunction. The normal erection depends mainly on the nerve supply and blood flow to the penis. Every patient needs supportive care in making decisions and coping with erectile dysfunction. Learn the facts about prostate cancer, about prostate infections and BPH, and share concerns with your partner. Lack of knowledge will raise your anxiety level, and it's already anxiety-causing enough. Examine all the pros and cons of treatment options. Talk with other men who have been diagnosed, like support groups online or even face-to-face groups. Ask your nurse those questions you and your partner are concerned with, especially those questions about adverse side effects related to prostate problems. Communicate with your health team, know the risk, and discuss treatments. Some good news is after a radical prostatectomy, fewer than 10% will die in 15 years. And you must know that at the age of prostate cancer, you are probably already over 60. There are options for erectile dysfunction. Ask your nurse for counseling sessions for you and your partner if you get overwhelmed. Ask your nurse about a written survivorship care plan, a packet that addresses the issues of side effects. We may not know what causes prostate problems like BPH, infections, or prostate cancer, but there are treatments. Thank you for your time, and I hope that if you have any questions that you will ask, and I will be glad to answer them. Thank you.